Hi everyone, welcome to my presentation. This is my creative and innovative use of technology in dental hygiene education. This is an individual project presented by myself, Jamie Clapp. For this presentation, I decided to do a PowerPoint. I had surgery on my dominant hand this morning, so I'm going to try to navigate through this PowerPoint one-handed, so bear with me if you will. For my first lesson, I chose to review a periodontal case study. In this case, the student works with an actual patient in the clinic, and they gather demographics and all the assessments. You can see the list here. Assessments vary from periodontal charting to hard tissue charting to caries risk, periodontal risk, intraoral before photos are also required with a digital camera. What the student is to do is to formulate a care plan, or a treatment plan. They need to execute the plan and complete it, and then they bring the patient back to reevaluate their condition. And at that time, they'll also take after photos with an intraoral camera, and then they're required to present the entire case using an infographic to the class. The technology that's required for this is obviously a network and a computer, but internet access. So the software they use is all online, and again, an intraoral camera. Teachers are required to be able to help the students with critical thinking. Once all the data is gathered, they need to analyze all of that and kind of determine the best plan of action, best treatment, and answer any questions they need to arrive to what we consider an evidence-based dental hygiene diagnosis. The students, on the other hand, again, they need basic computer skills. They need to be able to utilize word tools because, and we'll get to that in a minute, but the software that I'm recommending this be presented with, it's things like that: font, size, shapes, so on and so forth, a visual tool. Critical thinking, they need to be able to put the pieces together. They need to be organized and orderly. And we always consider professionalism whenever students are working and interviewing patients. So what does this process look like? What will the students do? Again, they're going to find a patient who meets all the criteria. Criteria are typically somebody who has a certain level of disease, and that is because we want them to be able to assess and treat and reevaluate. They need to complete all the assessments and gather and organize all the information. Again, take before photos before any treatment is done. They need to analyze information collected and create a treatment plan based on the stage of disease that the patient is in. They need to initiate and complete the agreed upon treatment, reevaluate the patient's condition, and take after intraoral photos to compare before and after. And then they need to present their case and findings to the class, again using an infographic. We'll get to that in just a second. This is just a quick example of what the stages look like for periodontal disease. So we're from healthy gums to severe. And the more severe, the harder it is to treat, the longer it is to treat, but we notice more results when we're comparing before and after photos. When we talk about intraoral photos, this is an example. This treatment was scaling and root planing. So the before photo on your left, you can see all of the buildup on the teeth, and the after, the cleaning has been done. Tissue's still a little red because they haven't healed completely, but that's kind of the idea of what we're looking for. As far as the intraoral camera, when using this, they need to make sure that their camera is protected with a barrier for infection control. They can plug the camera into the computer. In the selected patient's chart that they're working with, they're going to click anywhere in an image box. So each patient has a set of images and radiographs, so they need to bring that up. Dental hygiene students typically work with this often, so this is kind of one of the basic skills. They should be able to do this because we look at x-rays on every patient. When they open the image box, they're going to click Acquire button, and I'll show you an image of that in just a second. And then when the green light appears, they can take the desired photo, and they need to be sure to save and label the photo as necessary. So this is what it looks like in a patient's chart. This is just an example, but you see the orange arrow is pointing. That is the little Acquire button. Sometimes it's an image. If they're using a different software, this is Dexis, but if they're using something like EagleSoft, it'll be probably a word that actually says Acquire. So once they've gathered all the information, they've did all the treatment, they've done the reevaluation, which this an assignment like this typically takes all semester. At the end of the semester, they need to put their presentation together and present it to the class. So how this would work is they'll organize the information and pick out highlights to be emphasized. They're going to find a free online infographic creator. PictoChart, Visually Easily, Venngage, or Infogram. PictoChart seems to be the one that I lean towards the most, but they all work great and they're all free. They can use a template or create their own. They must be creative with their topic and information. They have to include intraoral photos and point out the areas of interest. And they present the completed infographic, again, to their classmates. And the reason we do this is because every patient is different, every case is different, and it's a very, very visual program, and it's very helpful for students to be able to learn from one another by looking at images. So if we put all the pieces together, we can show them, you start here and you end here, and this is what happened in between to reach the destination that they're looking to go to. So this is just a quick screenshot of PictoChart. These are examples of infograms. They're very visual. Dental hygiene, again, is a very visual learning program, so that's why I chose this innovative use of technology. The advantages of this, is that we can highlight the important findings. We don't have to point out everything or, number of teeth, because everyone has the same number of teeth, technically speaking. This communicates messages and experiences. It presents large amounts of data. It helps students understand complex patient cases. And I kind of talked about before, they can share all of their learning experiences among each other because each case is technically different, and you never know what your patient's going to present with. Intraoral images are a great patient educational tool. The infograms are structured close-ups for diagnostic purposes and patient records or treatment planning. So these are all good things about infographics and intraoral cameras. Disadvantage is if a student is poorly organized, poor planning, their research can lead to misinformed and misinterpreted information by the patient. Information and knowledge and research, especially in healthcare, changes constantly. So patient recommendations may change. Patient consent must be obtained to share their case. We do abide by all HIPAA rules, so patient information, such as name, social security number, birth date, and all that is not included. It's pretty much just age and demographics. Are they a smoker? Do they go to the dentist? So on and so forth. How many teeth do they have? How many fillings? Too many 3D and special effects create distraction from the information that you're trying to share. And if the patients don't show up for the reevaluations, which sometimes happen being a community clinic, you don't typically have the conclusion to your project, and assumptions have to be made. So, we're kind of guessing at that point. And then lastly, intraoral camera images can be blurry due to saliva, mouth breathing, or patient movement. So sometimes if we don't have great before and after, the visual part, before and afters aren't the greatest, which we like to have great ones because that's how we learn the best. This innovation can definitely be shared among other dental students, professionals, and staff for experience, recommendation, considerations, and just examples for learning. Intraoral photos are good learning tools visually for students, for patient education, treatment plan acceptance, and they can be used over and over. So it definitely can be shared among others. The visual items can be used as long as information continues to be current. So as soon as new research comes out, and let's say we recommended a product that maybe is no longer on the market, well, then then sharing kind of becomes, not as useful. Moving on to Lesson 2. Lesson 2 talks about our first-year dental hygiene students, and this is when most of our clinical assignments for first-year dental students is to learn the instruments that they're going to forever use for patient care. So an introduction is usually made in a lecture course, and it comes to life with a demonstration by a clinical instructor in small groups. This is where the technology I've decided to use for this project is computer-assisted instruction, which would make a more calibrated learning opportunity for students. And there's someone in particular who has created a program that could fit into the dental hygiene program, and her name is Anna Pattison. She's out in California, which is kind of nice because we'll mention that at one point, but computer-assisted instruction doesn't always, we'll get to that before I spoil all the good information. Technology required, again, a network and a computer and internet access that'll support the videos. Teachers are required, again, to have basic computer skills. Teachers must also watch the videos within the program to make sure that the connection in a lecture to a clinical portion, they need to be able to make that connection. So what they're learning on the video needs to come to life in clinic. They must also ensure patient safety. When you're learning something via video, we want to make sure that you're safe with patients and that you can physically do it in the clinical setting. Skills required of students, basic computer skills. They must be able to access the internet, log in, and navigate the website. Students must listen and engage in computer-assisted instruction for best results. So while they're listening to these instructive videos, they can actually practice their instruments on a typodont before they try on a partner in clinic. Computer-assisted instruction is a process that leads to a finished product. So what that means is it's a process or sequence that students follow, and in the end they meet all of the demanded objectives. So it's a curriculum they're learning. The student will finish by meeting assigned objectives and outcomes. In this case, the skills are reviewed and assessed in the dental clinic by a calibrated instructor. The student benefits by accomplishing each of the units and the entire curriculum or coursework that they're engaged in. Coursework may be included or may include reading, videos, tutorials, quizzes, simulations, or similar to engage them in active learning and to keep them in active learning mode. So what is the process the students will follow? Well, they need to turn their computer on and ensure internet connection. They'll open a new internet browser and they'll go to Pattison Institute, and I'll bring you there in just a minute. They will log in. They can wear and connect headphones if desired, if they're at a setting where they can't listen out loud. They will begin and complete each assigned unit prior to clinical practice time. So let's say week 1 is unit 1, week 2 is unit 2, so on and so forth. They'll use the mouse or keyboard to navigate through the unit, pause, rewind, and review. And once complete, they'll log out, shut down the computer, and then always ask for help if they need it. Advantages of computer-assisted instruction is it's definitely individualized learning. It's self-paced, it's individual attention, and self-directed learning. This allows teachers to spend more time with students who require it. It allows slower students to have more time reviewing the instruction before they practice it in clinic, and it provides instantaneous responses with immediate feedback. So when we're in clinic and they're actually trying the instrument first time, we give them immediate feedback. In this case, computer-assisted learning teaches the unit, then students practice it in clinic with instructions providing constructive feedback. Again, kind of reiterating what I've already said. Computer-assisted learning also ensures quality calibration between instructors. Therefore, students are hearing the information in the same manner. So it's always good when we can connect all of the lectures in the program to something in clinic, whether it's pathology, pharmacology, instrumentation. The disadvantages of computer-assisted instruction is that learning can become too mechanical. Lack of infrastructure, overuse of multimedia can divert the student's attention. The students can feel overwhelmed by the information and resources available if they're not understanding what she's saying, because she uses a lot of dental terms like keep the terminal shank parallel to the long axis of the tooth. If they don't know what that means, they're going to get really overwhelmed and they're going to give up. It may also be difficult to find a good computer-assisted instruction program and to use to fit it for your specifications. So in this case, for this dental portion, I've found one that is specific to dental hygiene instrumentation. Other topics, it gets kind of expensive to create a program or to find one that's specific to your needs. Again, in healthcare, topics are rapidly changing, new instruments are created, so on and so forth. So if you're teaching a video or the students are listening to a video and it's an old instrument, that's kind of a disadvantage. Computer-assisted instruction may be costly. We talked about that. And lack of instructor collaboration with the computer could create frustration when within students and create the whole he said, she said types of situations. So we try to avoid that by requiring that teachers review the information prior to clinic also. And a lot of them have been there for a long time, so it's the same information. I'm sorry that this is kind of dark and we can't really see the screen, but sharing this, I kind of touched base on that the last slide, is it can be shared among other dental hygiene students, current dental professionals, or anyone who wants to learn dental instrumentation, so dental programs for sure. This is not something that would necessarily be shared with the general public. It is an expensive course to use, and secondly, it's for a specific population, such as dental providers. So that said, all dental offices and dental programs have the access and the option to purchase the program and utilize it. It's probably no use to anyone outside of dental. So that is the end of my PowerPoint, but I wanted to just briefly show. This is the Pattinson website, and this is where students would come in and log on, and that might, yep, and then, sorry, let me back up a second. This is basically their videos, so they're broke down into assessments, and you can see a little example of the video on the far right. That's what they'll do. They'll work on fake teeth to learn an instrument, and there's talk scaling instruments, there's evaluation instruments, so this is kind of a nice. This is a really nice tool to make sure all the students hear the same information over and over. I'm a big fan of computer-assisted instruction because then they can go right into clinic and practice it. Lesson 1 was about infographics, and my favorite I said was PictoChart. So here's an example of one that I've created for a different course. But kind of same thing, it's visual, you can upload documents, you can use symbols, you can point out the most important information. I just kind of scroll through this for a second. You know, you use images, so like a clock for time, money for money. I don't know, I still have the words in there, but you can get really creative. In this case, you can create your own, or you can use templates that they've already created for you, which is also very handy. I think that concludes most of the information for my innovative uses of technology. Thank you for watching.